Thank you, Sam. You got our attention. In 2021, Hartford Hospital visitors had a one-year record for heart transplants with 40 transplants performed, and the most in Connecticut and second most in New England. The program also marked its 500th heart transplant in the program history. As we transition into the new year, the program continues to be one of the top in the country. Here to talk more about this is Hartford Hospital's heart transplant program is Dr. Ayyaz Ali, Surgical Director of the Heart Transplant at Hartford Hospital. Doctor, welcome.
Thank you very much. Thank you for having me.
Thanks for being here. So Hartford Hospital's heart transplant program continues to have major milestones. Why has this program been so successful?
Well, we're very committed to offering this therapy to those patients in Connecticut who are very much in need of it. And heart transplantation is a very special therapy, of course, because the provision of organ donors is very rare. So we're relying on a resource which we don't have any control over. And of course, we have excellent organ donation systems in this country. In fact, last year in the United States, we performed over 40,000 solid organ transplants. So we have an excellent organ donation infrastructure. So then it's our responsibility as healthcare systems to make the most of this precious gift of life that our brave organ donors and their families are able to provide to us. So it's something that we're very committed to for that reason, because again, it's a very generous gift. It's a very robust system that we have, so we need to take advantage of that and make sure that we responsibly obtain these organs to help those that are in need, whichever solid organ we need to transplant. And of course, in our situation here, we're transplanting hearts. So we really strive to make sure that we very carefully vet all the organs that are offered to us. And this is the reason why we've been so successful, because we've been very open and inclusive in terms of the organs that we select.
All right, when we think of heart transplant patients, we usually think of the most critical in the ICU, but patients can be on the transplant list for a heart if they're in need or at high risk. So what is the criteria to get on the transplant list?
So the way that the organ allocation in this country works is that the likelihood of you receiving an organ really depends upon how sick you are and the urgency with which you need heart. So patients who need heart transplants range from those who are intensive care units and who have life-threatening illness to those patients who also have heart failure, albeit more stable, at home. But many of those patients as well are struggling to do their day-to-day needs. So we are able to we need to look at the entire spectrum of patients with heart failure and their severity, and that is really what determines where they go onto the list. Now, to get onto the heart transplant waiting list, there's a very thorough evaluation process, and sometimes we have to do that very quickly if patients end up in the hospital, again, as I said, with an acute, sudden, severe, life-threatening illness associated with their heart failure, or sometimes when they're more stable and we see them in the outpatient setting in the clinics, we have more time to undergo that evaluation. Nevertheless, it's always very thorough. But again, at the same time, we want to try to be as inclusive as possible, and that's the key. We don't want to say no. We want to say yes if at all we feel that a heart transplant is going to be able to help them get back to a good, healthy life.
Excellent information, Dr. Ayyaz Ali. Thank you so much for being with us.
Thank you very much.